About the other question?
Well, I think you wanted to follow up on the hydroxychloroquine.
The hydroxychloroquine. I'm wondering if you're concerned. This VA study showed that actually more people died that used the drug that didn't, and I'm wondering if Governor Cuomo brought you back any results.
No, we didn't discuss it, and I don't know of the report. Obviously, there have been some very good reports, and perhaps this one's not a good report. But we'll be looking at it. We'll have a comment on it.
A panel of experts at the NIH is actually now recommending against the use of hydroxychloroquine in combination with Z-Pak, which is something you've
we'll
been
take a look at
recommending.
it. I'm always willing to take a look. Brett?
Another subject, you were signing of the executive order. When do you plan to do that?
The executive order will be, it's being written now as we speak, probably tomorrow sometime.
So will it have exemptions in there for
We'll have certain exemptions because you're going to need certain exemptions, but we'll be notifying you tomorrow. We'll sign it most likely tomorrow, being drawn now and tonight. And it's something we have to have in this country. We have to have it.
So for the people who say it doesn't track with opening up the country to shut down immigration across the board for companies that, and the pipeline that's already in place, what do you say to them?
Well, I think it really does. I think it's very strong, obviously, and it's countrywide as opposed to specifically like China or some of the other ones that I've shut down. We're going to see, and you'll see a very accurate definition tomorrow after it's completed by the attorneys.
Last thing for me, North Korea. What can you tell us about the status of Kim Jongun?
Well, these are reports that came out, and we don't know. We don't know. I've had a very good relationship with him. I wouldn't, I can only say this: I wish him well, because if he is in the kind of condition that the reports say, that the news is saying, that would be that's a very serious condition, as you know. But I wish him well. We've had a good relationship. I've said it, and I've said it many times. If somebody else were in this position, we would have been right now at war with North Korea. And we're not at war, and we're nowhere close to war with North Korea. So I just have to say to Kim Jong-un, I wish him very, good luck. Good luck. I mean, they came out with very, very serious medical reports. Nobody's confirmed that. It was CNN that came out. So when CNN comes out with a report, I don't place too much credence in it.
Your meeting with Governor Cuomo, did he convince you of a need for expanded testing? Or
No, we had a great talk on testing, and we have an agreement. We have an understanding on testing. They have labs, tremendous labs, as you know, in New York, especially in the Manhattan area, but all over the state. And great medical schools and federal labs. So we have a very good understanding. We're going to do very significant testing. Not everybody wants to do such significant testing. Testing is good in some cases, and in some cases it's not. You have governors that don't want to go all out in the testing because they think they can do it in a different manner and do it better. But we had a very good meeting today. The governor and I had a very good meeting.
Is there more federal aid that can be used to help governors who want to expand testing? Because we keep hearing that all day long.
We have $25 billion, and that's a tremendous amount of money. That's much far more money than, in my opinion, that we'll need. And again, already we're testing more by far than any country. I think I read yesterday a report that we've done more than everybody else, every other country combined, and I think our people should be getting a lot of credit for that. We've done a lot more than everybody else combined, and you never hear that in the news. It's unfortunate. Yeah, please.
Mr. President, just back on the executive order for a second. You mentioned that there are going to be some exemptions. We're reporting right now that it only applies to employment, green cards for employment, but not for those for
It is
immediate
green
family.
cards, but we're going to be reporting on that later on. It might be tonight or tomorrow. We'll give you an exact report.
You can say to people who may be worried about the ability to bring immediate family members into this.
No, I think it's been covered pretty accurately in this case. I think most people know what it is, and some people will be able to get in. We have to do that, obviously, even from a humane standpoint. But there'll be some people coming in. But it's a strong order. It's a strong order. It involves a big circle, as you know. Please.
Are immigrants who are already in the country, are they at greater risk of deportation based on this order?
I don't think so. They're not supposed to be here. You're saying they're here illegally? Is that what you're saying?
Well, for example, if an immigrant is here for a court order, right, are they at risk of deportation
Well, if a
based
court
on
order,
this?
then you have to go to court. So then the judge would make a determination as to whether or not they're going to be staying. But if they have a court order, they won't have to leave until they go through that process. So we'll see what happens. But with the court, and there are some with court orders, that means they have a trial coming up. Please.
Yes, so obviously on the immigration executive order, you've raised concern for a long time, even in good economic times, about immigrants taking Americans' jobs. So under what conditions would you consider lifting this halt on immigration?
Well, we're going, yeah.
Or is this sort of an opportunity to address what you've seen as a problem for a long time?
Well, I think, look, right now, obviously, there's never been, we had the greatest economy in the world, and then one day we had to shut it down. They said, you have to shut it down. We did the right thing, because I think we would have had 1 million or maybe even 2 million, or maybe more than that deaths. So we did the right thing. But certainly this would pertain. I mean, when you look at it right now, the last thing we want to do is take American workers' jobs. It's one thing when we were essentially, they used to call it full employment, and it's another thing right now. Right now we have people that have lost their jobs, and we hope they're going to come back and come back fast, and then we can have an even deeper discussion. But right now we have to have jobs for Americans.
Would you have any sense of, like, if unemployment gets to 4% or 5%?
Well,
People who are
we'll have
looking
to see. I mean, I hope we're in that position to have that debate. Right now, we're not in that position. Right now, we closed down the largest economy, the greatest economy in the history of the world. It's the most successful economy. When you look at the stock market, we're breaking records virtually every week, sometimes every day. And stock market's still not doing badly considering what this country has been through, which really tells you how strong it was in the first place. But no, I hope we're going to be able to have that discussion. I hope we're in a position. That's like a good discussion to have. But that'll be a little bit later. Brett?
I have a question for Dr. Burks about the CDC director said in an interview that perhaps this second wave of the coronavirus in the fall could be worse because it is timed with the seasonal flu. I'm just wondering if you could talk about that in context of as you're opening up the country and these guidelines that you've laid out.
Yeah, so we were very clear in the guidelines that we believe we can monitor communities at the community level by using the influenza-like illness and the syndromic respiratory and gastrointestinal components of this particular virus. Obviously, when we have flu, we're working on an algorithm that you test for flu, and then you test for COVID, and making sure that we are building the testing capacity to be able to do that. Because I think it's very important that you're going to be able, on the surface, a patient when they come in with early flu and early COVID can look very close to get identical. So we need to have testing in place to be able to separate and ensure those patients receive the best treatment. We're also hoping by that time that we have additional treatment options for people with COVID-19 so that there will be additional treatment available in the fall.
Your message would be to prepare for that time, thinking that it'll come back together.
The president has made it clear that we have the emergency, which we have been working on, the opening up guidelines, and just like he talks about phase 4, he has us very much working on the next 60, 90, and for all on with fall, and that's why he's not stopped any of the ventilator orders. It's very important that we have a completely refreshed and a comprehensive stockpile going into the fall, and I think that's why we continue to bring in those shipments and work on the ventilators so that those would be available not only for the United States, but certainly if other partner countries have this level of tragedy.
So you agree, if I can follow up on that? So you agree this could come back actually worse in the fall?
I don't know if it will be worse. I think this has been pretty bad. When you see what has happened in New York, that was very bad. I believe that we'll have early warning signals, both from our surveillance that we've been talking about on the vulnerable populations. We're going to continue that surveillance from now all the way through the fall to be able to give us that early warning signal. I think what we've learned is how good Americans are about immediately reverting to all of those issues that they need to do in order to ensure that they're protected and their families.
And Mr. President, what do you say to the concerns like Georgia is opening up barber shops and bowling alleys and the like, and you saw Lindsey Graham is saying he's concerned that Georgia may be going too far too fast, and it could affect people in South Carolina. Obviously, people travel back and forth between states. How do you protect the people of South Carolina, for example, from a potentially bad decision by a governor in Georgia?
So he's a very capable man. He knows what he's doing. He's done a very good job as governor, Georgia, and by the way, and South Carolina. Governor McMaster also. So you have two very capable people. We're going to find out. And in fact, I'm scheduled to speak to the governor of Georgia in a little while. But we'll find out.
Graham's concern that what happens in Georgia can
Well,
affect South
everybody, I have a
Carolina.
concern about what happens everywhere. I mean, we've got those concerns. And as far as coming back, if they do come back, and they could come back together with heavy on the flu and much lighter on, because I really believe we'll be able to put out the fires. You know, it's like fires. And we've learned a lot. You know, we've become very good at this. When you look at what's happening, when you look at the numbers coming down, a lot of states are in really great shape. You're going to see a lot of openings. But I'll be speaking to the governor of Georgia in a little while. Okay?
Mr. President, so the American people need to be prepared for going back to social distancing, even if things relax over the summer. But come the fall, if the virus comes back in coincidence.
Well, I
with
could
the flu.
see them, and I'll speak for the doctor, and if you'd like either of you to say, but I would say that you keep away until this thing is gone. It's going to be gone at some point. It's going to be gone. And I would say you keep away and you do the social distancing until such time as you know it's gone. We'll know when that time is.
Your executive order is to last for 60 days. How will you decide whether to extend it? Does it
Well, I'll look at the
depend on-
economy. I'll see where we are with the economy, basically, and I think I'll have a very easy decision to make. I hope that the economy is going to be great by that time, but we'll see. But right now, in light of the fact that Americans are out of jobs, I can't be taken in.
Roll it for another 60 days or?
Well, I could roll it for 30 days, or I could roll it for much more than 60 days. We'll have to take a look at the time, but we'll be looking at 60 days, and we'll see what it is. Yeah, in the back.
And there is reporting that you.
Under immigration order.
That's all right. You go. Why don't you go, and then you?
Okay, on the immigration order, we'll continue with that. There is reporting that you may actually sign a second order to even limit more of those exemptions that you were just talking about. Can you confirm that
It
you
could
are
happen
considering?
if I want, but I won't be doing it tomorrow. I'll be signing the primary order, and then we have a secondary order that if I want to do that, we'll make that determination. We
Is
can
that-
do that. Yeah, we can do that at a little bit different time if we want.
But that is under consideration at this
Yeah,
time, a
sure,
second
sure.
order?
Secondary orders, yeah. Please.
Thank you, Mr. President. I have two questions, one from me and one from a reporter who couldn't be in the room because of
You
social
always have
distancing.
one from him, one from her.
That's the seat. This is a print
Good, that's
seat.
good.
So my first question is about your immigration order. You campaigned on reducing legal immigration. I remember your speech in Phoenix in 2016 on reducing legal immigration.
No, I can't
In
be
this-
legal and illegal, but no, I've always said you have to come into the country legally, so not legal. What I campaigned on was people just flooding our border and stopping. And by the way, speaking of that, we have 170 miles, almost 170 miles of very powerful border wall up, and it's moving rapidly, very quickly, and it's having a tremendous impact, and it's making our job a lot easier. Plus, Mexico has 27,000 soldiers right now on our southern border that we share with them, and Mexico's been terrific. They've really helped.
You also campaigned on reducing legal immigration. And I'm wondering if some critics are saying that you are using the virus now in this crisis to follow through on that promise to reduce legal immigration.
No. Well, I want people that are in this country, I want our citizens to get jobs. I don't want them to have competition. We have a very unusual situation where something came in that nobody has seen for many, many decades. Probably 1917 would be the closest analogy if you look at it, when you look at the contagion, the kind of contagion we're talking about. So, no, I'm not doing that at all. I want the American worker and our American citizens to be able to get jobs. I don't want them to compete right now. There's a big difference when we have a full economy, and frankly, where some of the companies, we have many companies moving in, where they need workers. That's a big difference between that and where all of a sudden a lot of people lose jobs.
As you know, a lot of farmers rely on seasonal migrant workers that
That's
come in
not
on
going
the
to be affected. The farmers will not be. That's an important point. The farmers will not be affected. Yeah, that's a very important point. I mean, it's a great point, actually. I'm glad you brought it up. No, the farmers will not be affected.
Your
They've had cases where they stopped everybody from coming in, and all the farmers went out of business. They were literally out of business. You remember that, Brett? It was not so long ago, but it's easy. It's easier to stop everything cold than it is to plan it so that the farmers have the people that have been working on those farms for many years, and that's what we're doing. No, the farmers will not be affected by this at all. If anything, we're going to make it easier, and we're doing a process that will make it better for those workers to come in, to go to the farm where they've been for a long time.
Now, for a question from a reporter who's out of the room, this is from the Washington Times, Tom Howell. Why hasn't the CDC, the federal government's main disease-fighting agency, had a more public-facing role amid the pandemic? It was holding regular media calls early on, but has not held one since early to mid-March.
Well, I can tell you that CDC has been terrific. We've worked with them very closely. They were very much involved, even in the border decision that I made last night. And the director's doing a good job. And we have always, whether it's Tony or Deborah or Steve, we have always a lot of people up. And certainly, as you've seen, the director's been here a lot, right? He's been here. He's been sitting here. He's been speaking a lot. No, CDC is very much involved in everything we've done.
Well,
yeah, please.
More calls.
The director of the CDC said the protests against stay-at-home orders are not helpful. You've encouraged some of these protests. What are your thoughts on the CDC director saying that these protests are not a good idea?
People, look, it's not a question of helpful or not. People want to get back to work. And I've watched some of the protests, not in great detail, but I've seen that, and they're separated. There's a lot of space in between. I mean, they're watching, believe it or not, they're doing social distancing, if you can believe it. And they are, and they're protesting, but the groups I've seen have been very much spread out. So I think that's good. Look, people, they want to get back to work. They got to make a living. They have to take care of their family. They don't want to do this. It's, unfortunate, maybe one way or the other. Both are unfortunate. But you have a lot of people out there that are anxious to get back. Yeah, please.
Surveys seem to be indicating that people are actually more concerned. More people are concerned about the virus spread, and they don't want to go out.
Yeah.
They
No,
don't
that's
want to
true.
go to work. They
They're
don't want
both.
to go outside.
They're two groups. They're big groups, both of them.
So my question is, what good is it for these businesses that would reopen if the customers are
Well,
afraid
at
to
the
go
same
outside?
time, we have to build back our country, and I'm going to make our country bigger and better and stronger, and we have to get started. There's a big difference, though, because people have really been through a lot, and they understand what to do now. Before, nobody had ever heard of a thing like this. Wouldn't you say? I mean, nobody ever heard of a thing like this. Distancing, social distancing, what does that mean? Washing your hands every 15 minutes, what does that mean? I mean, people had never seen or heard about anything like this. Now they really are. They've not only have they done it, but they've done a good job of it. But you have people, you can't break the country. At some point, you have to go back. Now, hopefully the governors are going to do, because I want the governors, and I've always wanted that. You could call it federalism, you can call it whatever you want. But the governors, I want them to do it. If we see them doing something we don't like, we'll stop it very quickly. But they're doing a good job. They're being careful. Some of the governors, frankly, they're in a position where they can do it sooner, or they can do it a little bit later, and that's okay. But people, they don't want to. They need money. They need help. We're going to lose, and we can't break our country over this. We can't do it. We have to get going. With that being said, some are going to go soon, and some are not. Yeah, in the back, please.
If I might just, pardon me, hair salons, nail salons, tattoo parlors. Yeah. Dr. Burks, can you weigh in on this? Because the people of Atlanta want to hear from you as well, as much as they want to hear from their governor and from you, Mr. President.
I think it's fine.
How do you safely have hair salons and nail salons and tattoo parlors where people this is in Georgia, where people have to inherently be close together?
I think what I've been trying to communicate over the last several days is it's really important that the governors and mayors communicate critical information to their communities and show very clearly the data. Remember, we wanted this data and evidence-based, the data that they utilize to make decisions and the data that the mayors should use in each of the communities, because it will have to be on a community-by-community opening, because there are different communities in different places, even in Georgia. And so I believe people in Atlanta would understand that if their cases are not going down, that they need to continue to do everything that we said: social distancing, washing your hands, wearing a mask in public. So if there's a way that people can social distance and do those things, then they can do those things. I don't know how, but people are very creative. So I'm not going to prejudge, but we have told people very clearly, and the president guidelines made it very clear about the expectations of phase one. And remember, phase one also included social distancing in restaurants, social distancing in every place that was entertainment, and keeping your own individual social groups to less than 10. I mean, we've been very clear in the guidelines, and I think it's up to the governors and mayors to ensure that they're following the best they can each of those phases to make sure that both the public is completely protected. But the governors and mayors also need to communicate very clearly on the data that was used for decision-making and make that transparent and available to their communities.
And it also depends, as an example that you just gave, are they doing testing before they go in? We have to find that out. That's why I'm speaking to the governor a little while, and I'll be asking him those questions. Please, go ahead.
Thank you, Mr. President. Just trying to get a sense of what you have left in the toolbox as it relates to oil. You hashed out the deal with OPEC Plus. You've ordered for purchases into the SPR. I mean, what else can be done?
Well, the biggest thing in the toolbox is to get our country open. That's by far the biggest thing there is. If we can open pretty well, and I think we're going to, over a period of time, piece by piece, puzzle, remember? If we can open well, I think that's your biggest part by far. That's where the engine is, more important than any other thing that we can work on. Please, go ahead.
Thank you, Mr. President. Two New York-related questions. In your meeting with Governor Cuomo, was there talk about providing states like New York with aid in the fourth stimulus package? I'm wondering if you have any thoughts on whether that aid should be tied to infection rates, whether states like New York, New Jersey that have been hardest hit should receive more money, and also wondering if you have any thoughts on Mayor Bill de Blasio saying today that he'd like to host a ticker tape parade of sorts once this is all over to honor the healthcare workers. As a New Yorker, have any thoughts?
Frankly, that sounds like a good idea to me. When it's all over, it sounds like a great idea. They deserve it. They're warriors. They've done an incredible job. We mentioned briefly the state aid. We talked about that, Governor Cuomo and myself, and I agree with him on that. And I think most Republicans agree too, and Democrats. And that's part of phase 4. And I think infrastructure is going to be a big part. We have to rebuild our country. I mean, you take a look where we spend, and we go over this all the time, but $8 trillion in the Middle East. We want to rebuild our country. And that means our bridges, our tunnels, even schools. We're doing something with schools. We have to do our roadways. That what's happened. We spend so much money on other countries that they don't appreciate it. Okay? They don't appreciate it. We're going to spend money now on our country, and it's going to be our jobs, and it's going to be our equipment. It's going to be made. Much of it is going to be made here. Hopefully, at some point, all of it's going to be made here. John?
Mr. President, at that podium back on March 9th, Vice President Pence said that over 1 million tests had been distributed, and then he said, and this is an exact quote, before the end of this week, another 4 million tests will be distributed. As you know now, 6 weeks later, we still aren't at 4 million tests.
I don't know what to say.
With the testing.
Ready? Are you ready? Again, I'll say it for the 5th time. We have tested more than any country in the world, and some of the countries are very big. Okay, more than any country in the world. We have one of the most successful, if you call mortality rates, because one person, and I always say that for you in particular, one person is too many. But we've done very well. Our testing, if you add them all up, we've tested more. Now, I don't know what Mike Pence said, but I'm sure he could answer that question.
He's at 4 million tests, and we're 6 weeks later.
You ready? Again, we've tested more than every country in the world, even put together. So that's all I can say. As far as Mike, he'll answer your question when he's here. We'll be back tomorrow.
I just want to go back to the China deal and the phase 1 of this China deal.
Yeah.
The flight ban is still in place. How confident are you that the Chinese are not going to invoke the natural disaster clause to just wait before getting into there?
Well, we're going to see. Look, there's nobody ever been tougher on China than me. And that means for 20 years, you go back 20 years, I probably got elected at least partially on the fact that I've been very tough. I said China's been ripping us off for years. I'd go into Michigan, I'd go into Pennsylvania, make speeches unrelated to being a politician. I'd be invited. I'd be speaking to people, which I like to do because I love the people. I love the people of this country. And I'd make speeches. Nobody, I'd say, how did you let this happen with China? I even asked the leaders of China, how did this ever happen? Where our country loses tens of billions of dollars a year. And I don't mean just tens. Take a look, 200 billion, 300 billion, 400 billion, 500 billion dollars a year. How did they ever let a thing like this happen? Now, if you look at this last year, the deficit went way down, and I'm talking about even before. Now it's much different. But a lot of things are happening. Great things were happening, except all of a sudden, out of nowhere, came the invisible enemy. And we think we know where it came from, and we'll be talking about that probably a lot. But came the invisible enemy. There's been nobody tougher than me on China.
I have no guarantee that they are going to go ahead with this. Trace one.
But if that happens, we'll do a termination, and we'll do what I can do better than anybody. Yeah, please.
Mr. President, on China, have U.S. intelligence analysts told you that they think that the virus escaped from a Chinese research lab, that it was
Well, I can't tell you that. Have U.S. intelligence agents told me? I mean, what kind of a question is that?
Do you feel
I can't.
confident that-
Do you want me to tell you? Oh, let me tell you what they told me. Look, they told me plenty. They told me plenty. Brett?
I wanted to follow up on, you said about the small business program, Harvard's going to pay the money back. How confident are you that you can claw back money from
Well, I'm
places
going to
like
have to look.
Harvard?
I don't like when Harvard, that has, I think, a $40 billion endowment or some incredible amount of money, that Harvard gets this money. Harvard should pay that money back. I want Harvard to pay the money back, okay? And if they won't do that, then we won't do something else. They have to pay it back. I don't like it. I don't like it. This is meant for workers. This isn't meant for one of the richest institutions, not only far beyond schools, in the world. They got to pay it back. I want them to pay it back.
Yeah, Mr. President, your Florida clubs have had to furlough
Yeah,
workers.
that's true.
Have you thought about asking your family members to maybe keep some of those workers on the payroll to help instead of sending them to the federal
Well,
offer? We've seen other companies do that.
Yeah, in Doral, you're not allowed to have the golf courses open. You can't have the clubs open. You can't have anything. It's a big hotel and resort. And I think there's probably 700, 750 people. So you can't have anything open. And you say, what are we going to do? Have full payroll and have the whole place with, there's no income coming in. First of all, everyone's home, and they're supposed to be. Second of all, in Florida, you can't use golf courses. That one I'm not sure I agree with. You have parks and golf courses where you have open space, but that's what it is. So I have others also. Then I have others in different states. I have a lot of different properties. But again, my children run them, and I love my children, and I wish them well. I look forward to comparing my numbers to my children's numbers. I think I'll do better.
You haven't thought about asking them to
You
keep
understand that? Well, the closed property is like, you have to close them up, and then hopefully when things get better, we'll just open it up. But you can't have, many hundreds of employees standing around doing nothing. There's no customer. You're not allowed to have a customer. So in some places it's very strict. New Jersey's strict. New York is strict. And you have to do what you have to do. And it's too bad. I feel so badly when I see that. I think that it's a tough policy, but I go by whatever the policy. That's a state policy in the case of Florida.
You've communicated regularly with Kim Jong-un, the North Korean leader. Are you going to try to reach out to him to check on his condition?
Well, I may, but I just hope he's doing fine. I mean, I've had a very good relationship with Kim Jong-un, and that's to the benefit of the country. That's not a bad thing. That's a good thing. And I'd like to see him be well, and we'll see how he does. Again, I don't know that the reports are true.
Do they have a line of succession as far as you know?
I don't want to ask him that. I have asked him that, but it's not my purpose to tell you that, in all fairness. But, I hope he does well. Please.
Maybe I'll follow up with Dr. Burks for a moment. Dr. Burks, if you don't mind, I just wanted to follow up on the question we were asking you about with social distancing in some of these states. With Georgia opening back up, things like tattoo parlors, getting a massage, social distancing, maybe there are some creative ways, but it seems very difficult to do social distancing. So do you have a message for people in Georgia who are soon going to have a choice about going to the hair salon or the nail salon or getting that tattoo if they're not 6 feet apart and they're not able to follow these social distancing guidelines? What's your message to people in a state like Georgia?
Well, we made it very clear in a message to all of the American people with opening up America again, the criteria that we wanted states to follow. Those were careful criteria. There were only 6. They were carefully selected in conversations with epidemiologists around the world and with CDC to really pick things that people could understand and use platforms that people have utilized in the past. But it was built on the premise that it needs to be data-driven and it needs to protect those who are most vulnerable. And then it went through the phases, and the very first thing it says, in all phases, all individuals need to continue to wash hands, protect the vulnerable, ensure the safety of others. But in phase 1, it made it clear that social distancing was absolutely key. And I think it's on the White House website, and we ask every American to read it and to use that as their guidelines. Now, we've also asked governors to create county-level information so that communities can see the information and understand why they may be different than a different county, so that it's very transparent and understandable. I had a question here a couple of days ago on a Jacksonville beach, and Jacksonville is dramatically different than Miami. And I think that was reflected in why Jacksonville had a different set of information and regulations. So I'm not going to judge anyone about their decision making. What I'm going to say is we were very clear in what we really believe protects the safety of Americans, and that is clearly laid out in the Opening Up America Again.
If I may, I have a question because we got data from Tokyo, an increase of cases and a double of the cases in Singapore. We've been, looking a lot at Europe after China, and then we're back into this area of the world. Here we're talking about a plateau and then cases going down. Any lessons to take out of what's happening in this area in Asia after having put our attention somewhere else for so long?
The lesson is to be careful.
Yeah.
We've got to be very careful. We don't want that to happen. It could happen. I think we'd stamp it out if it does happen. We're not going to be doing any mass closings, I hope. So I think we could, I call them some burning embers, and we put them out. And I think we've gotten very good at that, but we'll see. But we don't want that to happen, no, absolutely.
You concerned, Mr. President, that once the reopening happened, we won't need to go back into reclosing.
I don't want to do that. You don't want to do that. Nobody in this room wants to do that. You look forward, I think, Brett, very soon, and John, sitting next to a lot of your fellow reporters, right? The room seems so empty this way. But it's one of those things. Yeah, go ahead, please.
Mr. President, thank you. On the topic of public support for your immigration freeze,
Right.
An Ipsos USA Today poll just came out and found 80% of Americans are supportive of the immigration halt, the temporary freeze.
Yes, I know that.
Did that have any, did public support have any effect on your decision making here? And are you surprised by those numbers?
Yeah, it's a high number. I did not see that number. I heard there was a poll. I'm sure there'll be a lot of polls. No, look, I think the American people want to make sure that they have jobs for the American people, not for people that come in many cases illegally into our country. So we're doing that. I don't know what the numbers are, but I think just common sense tells you that's where we should be, and that's where the American people want to be. And we're going to build our country back. And I'm telling you, with all of the things that we're doing and infrastructure, which we desperately need, it's going to be an incredible thing taking place. I think it's going to be a renaissance. We're going to have something that will be, a lot of people are going to go to work building those roads and bridges and tunnels and highways and all of the other things we're going to be building. And broadband for the Middle West. I mean, the farmers haven't been treated fairly. Let's face it, the farmers have been treated terribly when it comes to the internet, so we're going to take care of that. We're We're going to make them very happy. So we'll see you all tomorrow, and we'll have some interesting things to put out tonight. And I appreciate you being here, and it's an honor to have Brett Baer here. I've used his slot a lot, John. I've used that slot a lot.
Get on, Mr. President.
Huh?
The only
No.
way I can get on.
No, we want to have you back soon. Thank you very much. Thank you, everybody. Thank you. Thank you.
All right, there you see the President of the United States wrapping up his...
All right, folks, thank you so much for joining us and choosing us as your stream of choice here at Golden State Times. If you are new to the channel, we encourage you to subscribe and click that notification bell. Once again, if you're new to the channel, we encourage you to subscribe and click that bell. As you guys see on your screen, you click the subscribe button, the bell comes up, click on that, and then put notify all. That is the best way to do it, folks. Just wanted to show you guys real quick. Also, if you want to get notified by us instead of YouTube, we encourage you to sign up to our notification list. If you want to get notified by me directly when we go live for President Trump's press briefing tomorrow, all you have to do is send me a text like you see on your screen with the word Trump Live, all together, Trump Live, to the number 555-888. Again, that number is 555888. I hope that you guys liked today's coverage and the hot mic, always the hot mic, folks. We are that hot mic channel. And that is crazy because it just went viral, the one from yesterday. And a lot of patriots are asking very good questions. So if you guys want to check that out, you should look at our Twitter page at Gold State Times. So make sure you guys follow us on Twitter at Gold State Times and check out that clip from yesterday. It's posted, it's pinned to the profile. So make sure you go and check us out on Twitter at Gold State Times.